Greetings. I'd like to spend a few minutes talking about risk assessment and dangerousness. First, I'll mention a few things from one of the classic textbooks, in my opinion, Violence and Mental Disorder Developments in Risk Assessment, edited by Monahan and Stedman. Really gets us into a lot of the features that we'll be looking at. First, a few questions, though, and that is, what exactly is risk assessment, and what does it mean for someone to be labeled as being at risk or being dangerous? And how do we decide what's considered to be a risk factor and what is not? And also, do we look at the intensity or the level or the degree of risk, high risk, moderate risk, low risk, and what does that mean? And when we define violence, what does that mean? Does that mean threatening someone? Does that mean hitting someone? Does that mean stabbing someone, or a combination of those? And so a lot of times we have to look at the specific scales that are being used. And we run into comparative problems and methodological problems when that is the case. And so basically we have this very large study carried out, the MacArthur Study of Mental Disorder and Violence. And they published the results in general articles in mental health and criminological journals, also in a book, Rethinking Risk Assessment, the MacArthur Study of Mental Disorder and Violence, by Monahan, Stedman, Silver, and several other scholars. First, what I want to do is mention some of the areas that are covered. Now, when you think about risks, sometimes we have what we might call static versus dynamic, those that are not changeable and those that are changeable, the static and the dynamic. For example, gender. You can't change gender, and so on. Prior criminal history is prior criminal history. And then there's other things, of course, that can be changed, that are dynamic. But when we start looking at all these factors in the risk assessment research, the MacArthur study specifically, they look at things like dispositional factors. For example, demographic factors, age, gender, race and ethnicity, socioeconomic status, and also they look at personality features such as the personality style, anger, impulsivity, psychopathy. And they also look at cognitive, for example, looking at intelligence level or looking at neurological problems. Secondly, they look at historical factors, for example, the family history, employment history, educational history, whether there's a history of psychiatric or mental health issues, and also, very importantly, a history of crime and violence, to include arrests and incarcerations, and also reported violence toward others or even toward oneself. Third, they look at contextual factors, for example, stress and social support in their environment, their neighborhood, their social networks, and the like. Also, they look at the means for violence, for example, if they have access to weapons. And fourth, they look at clinical factors, which would be basically symptoms of mental disorders and diagnoses. For example, if they have particular symptoms that may be related to violent behavior, or if they have particular mental disorders that have also been shown to be related to violent behavior. Study is very interesting and really allows us to peer into the multiple factors that are related. And so I'm going to just summarize from Monahan's study, the MacArthur Studies of Violence Risk from Criminal Behavior and Mental Health, Volume 12, back in 2002. And basically to kind of summarize some of the features that were found, that there was not a difference between the men and women in the study. Well, let me back up and let me mention, and to quote Monahan on page let's see, 67. Go ahead. That the MacArthur Risk Assessment Study, my colleagues and I, Monahan et al., 2001, assessed over 1,000 acute civil patients at 3 mental health facilities in different American states on a wide variety of variables believed to be related to the occurrence of violence. And so they're looking at basically those that were assessed in acute civil patients, basically. So they're looking at those in the mental health facilities, not the general population. That's very important for me to mention. And so what they found in that population, for example, is that there was not a significant difference in violent prevalence between men and women, but it differed in in the context, which is kind of an interesting study. And so, for example, they found that where the violence occurred was different. And for example, they found men that engaged in violent behavior were more likely to be substance abusers and had low compliance on their medications, while women were more likely to engage in violent behavior in the home. They also found that engaging in prior violence was a risk factor. Having been physically abused as a child and or been exposed to deviant parenting was also considered to be a risk factor. And living in high crime neighborhoods is a risk factor. Having co-occurring mental disorders, comorbidity, which I talked about before, having more than one mental disorder was a risk for violence, as was personality disorders. Interestingly enough, having delusions was not a risk, but being suspicious was. Hallucinations was not a risk factor, found to be a risk factor, unless there were voices commanding the person to engage in violent behavior. Having violent thoughts was a risk factor, and having anger, high levels of anger, also was a risk factor. And so we begin to see that there are some very specific indicators or risks or certain characteristics or behaviors, either historically or currently, that lead us to the conclusion that there's a greater risk of engaging in violent behavior. But at the same time, this study also shows us that there's a lot of features related to what we call mental illness, which are not related to violent behavior. This is a book that the company sent me as a gift, or actually they want me to use it in my work, and I wouldn't probably use it in a course like this. I would use this more if I was teaching a counseling type course or assessment course, but Forensic Assessment and Violence Risk, a guide for risk assessment and risk management, very useful book that goes over a lot of the features. I don't want you to get the impression that we have this down to a precise science. Not at all. There's a lot of questions, a lot of problems, a lot of issues we still have to address. Interestingly enough, I was able to find online the Violence Risk Appraisal Guide, the VRAG, by Quincy, Harris, Rice, and Comer, published in 2006, actually a computerized one where you would answer 12 questions, respond to 12 questions, and then you would have a risk assessment score for a particular person. And I ran several cases that I basically just made up and found low, moderate, and high risk. But some of the things that they would look at in regards to violence risk appraisal, and basically what they're looking at is the probability of violent recidivism. And they look at 7 years and 10 years down the road, the probability of recidivism and classification. And then they have risk categories ranging from 1 to 9. But interestingly enough, some of the variables that are on there are living with both biological parents to age 16, except for the death of a parent, elementary school maladjustment, history of alcohol problems, marital status, criminal history score for convictions and charges, for nonviolent offenses prior to the index offense, failure on prior conditional release, age at index offense, victim injury, any female victim, meets the DSM-3 criteria for any personality disorder, meets the DSM-3 criteria for schizophrenia, and the score on the Harris psychopathy checklist. And that would be used. They have different methods of, or they have a method of scoring, adding those up to get a particular risk. And then you could look on the second page, and you can look at the probability of recidivism, and they give them in percentages. For example, the first case that I ran, there's a 44% chance of recidivism 7 years out, 58% in 10 years. The second one I ran, it's a much lower risk, and the third one that I ran, a much higher risk. And again, these are not precise, and the danger is if we were using these as if they would predict the future. We cannot predict the future. And I think really what's also important to recognize in all this is that if we have all these risk assessment tools, my thought process is, instead of saying, okay, look, this person is at high risk for recidivating, for committing violence, my idea is that if you get a high risk, you offer services and interventions immediately to try to reverse those risks. I have conducted risk assessments before. I can tell you once what happened in a case is that I wrote a report and sent it to the appropriate department, stating that if the child was returned to the home, the child would be at great risk, a high risk of being re-abused. And I was pretty confident that the judge would not return the child to the home because of the risk of abuse. Several months later, I got a call that they wanted me back on this case because the child was at home and had been re-abused. And I couldn't believe that the child had been returned home. I really got quite frustrated, and I said, no, I'm not taking this case. Why would you give me a case that the system, failed? The child so miserably. The system clearly fell, or the child fell through the cracks of the system. And why would I take a case on again that is going to fail? And why didn't the judge listen to my recommendation, where I basically said, I'm pretty confident if you return this child home, the child's going to be re-abused? I said, the judge obviously doesn't know what he's doing. The Department of Children, Youth, and Families, don't know what they're doing. The whole system is broken. And the caseworker said, let me contact the judge on this. Several days later, I get a call from the judge, because I did not have kind words for the judge. Interestingly enough, though, the judge explained to me that he never saw the report, and he got the report after he had returned the child home and after new abuse allegations were investigated and verified. And he was shocked as well. He never got the report, so we saw there was a system breakdown, and he wanted me to know that he would have never returned that child home if he had seen that report. And he asked me to please take the case again and we could start over. And I said, okay, I will. And it was a mess. And so, of course, what we do with these risk assessments is very important as well. I've also seen cases where people conduct, professionals and non-professionals conduct the so-called risk assessments, and they're very faulty. And the implications can be very negative as well. For example, I remember working with this adolescent, and he told me he went through the assessment center, and he lied and made things up that he was much, much more dangerous and worse off than he really was. And so I was thinking, well, maybe that's an invalid assessment, and hopefully they'll catch that. But certainly that's going to have negative consequences when he goes through the juvenile court system. And so there are some perils and pitfalls we have to be aware of, and we have to just look at all these risk assessments as a tool to help us to fit in a bigger picture. And there's lots of them. Sometimes I compare risk assessment tools to dieting books. There's a lot of them out there, and a lot of people claim they all work, but I always wonder, why are there always new ones? Are we getting better? Are people following these diet books and they're working, or not? Are people following these risk assessment tools? Are we getting better in the field, or why do I have? Here's just a small sample of some of the risk assessment tools I've collected over the years. And I think really when it comes down to it, that professionals will choose some of the state-of-the-art ones that have shown and demonstrated reliability and validity and are accepted as standards of practice in the field, and use those, while others are currently being tested and carried out. And many times they're revised, to keep up with new developments and research. So I think we're getting better, but certainly we don't have that Tom Cruise type movie where we'll be able to predict criminality in the future. That's just dangerous. That's dangerous. We need to do risk assessment of risk assessment. I don't know how well that would go over if I came up with a tool to assess risk of doing risk assessment. But I want you to beware of the consequences of all of this and the limitations. Let me wrap up by going back to Monahan and Stedman's excellent work, and they offer some recommendations. And even though this is several years old, I think these still hold true. So what they have to say regarding the next generation of risk assessment research. Number one, we need better definitions of dangerousness. Better definitions of dangerousness. Number two, we need to look at multiple domains of risk factors. That is real important as well. Do we want to return someone to their environment where there's a likely chance that recidivism will occur because of the social environment or the network or the peer group? We also want to look at the seriousness of harm. That's important to look at. That just to say someone's at risk for violent behavior, well, we want to know what exactly do we mean by at risk for violent behavior? Are they going to yell at someone? Are they going to hit someone, slap someone, push someone, shoot someone? We also want to look at how risk changes over time and context, looking at factors related to age, social environment, compliance with treatment, and so on. And we also want to, number 5, assess the relationship between the actual risk factors and harm, controlling for other factors as well, so we can see which are the most influential and very importantly, which we can do something about in assisting the person. 6th, we want to use representative samples in our research, so we can begin to start thinking about generalizing our results. And 7th, we want to manage risk, or we want to look at managing risk as an important area of study and an important area of funding as well. The whole idea is, in my opinion, is to start risk assessment when there are some initial indication of problems. I'll finally wrap up with one more example, and then we'll call it a day for this particular video. And that is a teacher once was talking to me, and she was telling me that one of her students that she had in junior high had killed someone, and the student was arrested and charged with murder. And so on, and the former student was, I think, around maybe 19 or 20, so it's a number of years later. And she said she wasn't surprised at all, that she knew this would happen eventually. And so how did you know? And so she started describing all these risk factors that she saw. And my question was, well, did anyone do anything about it? And she said, well, she tried to get the guy help, but he fell through the cracks of the system. He didn't get the assistance. He got worse. And then he moved on to other grades, and she heard that he was a troublemaker and this and that. And the final result was of this case is that he went ahead and killed someone. He had a lot of problems, but he never got any assistance, or they weren't addressed. There wasn't even an attempt to help the individual. And so the question, of course, could have this homicide have been prevented by early intervention? And so we'll see that that's very relevant and important as well. As far as I'm concerned, early intervention starts prenatally. That's where we have to start our interventions in terms of making sure we have babies that are born without experiencing risk factors before even birth. For example, exposure to environmental toxins and the like. And so there's really a lot that can be done, and we have to connect this to research, evidence-based programs to see what works and what doesn't. And this wraps up this video.